Insert a speculum into the vagina and grasp the cervix with a tenaculum. Sound the uterus with the SureSound uterine cavity measuring device, if available, by inserting the SureSound device into the cervical canal until you feel resistance at the internal os. Rotate the blue deployment ring clockwise into the unlocked position and slide distally until the inner probe contacts the fundus. Once you feel resistance at the fundus from the inner probe, read the uterine cavity length from the markings as indicated through the blue deployment ring. Retract the inner probe, lock the deployment tab by rotating counterclockwise and remove the SureSound device. If desired, perform diagnostic hysteroscopy with normal saline. Squeeze the handles of the sterile NovaSure device outside the patient to the locked position to open the array. Ensure that the red array position LED on the controller is extinguished and that the width dial reads greater than or equal to 4 centimeters. Unlock the device by pressing the lock release button and retract the array until it is completely enclosed by the external sheath by pulling back the device handle using the bow and arrow technique. The closed array indicator located at the hinge of the front and rear handles will read array closed to indicate the array has been retracted into the sheath. Adjust the cavity length on the length setting feature of the device to the value of the uterine cavity sounding length. Key this cavity length into the NovaSure RF controller length LED by depressing the up and down arrows. Dilate the cervix to 8 mm using a standard progression of graduated dilators. Maintain a slight traction on the tenaculum to minimize the angle of the uterus. Slide the white cervical collar all the way back on the sheath using the thumb tab. While holding the front handle, insert the device transcervically in line with the axis of the uterus until the distal end of the sheath reaches the fundus. Withdraw the disposable device approximately 0.5 centimeters from the fundus. Slowly squeeze the handles without locking the device up to the point of increased resistance. The width dial should read approximately 0.5 centimeters. At this point, the external sheath has been retracted. Continue to slowly squeeze the disposable device handles together while gently moving the device about half a centimeter to and from the fundus, while rotating the handle of the disposable device 45 degrees counterclockwise and clockwise until the handles lock. The width dial should read greater than 2.5 centimeters. Once locked, gently move the disposable device using anterior, posterior and lateral movements to the left and right. To complete placement, slightly pull back the disposable device until the width dial reading reduces by approximately 0.2 to 0.5 centimeters. Then gently advance towards the fundus. The width dial should read greater than or equal to the previous measurement and should always be at a minimum greater than 2.5 centimeters. Key the value indicated on the width dial into the NovaSure RF controller by depressing the up-down buttons. Slide the white cervical collar forward using gentle pressure on the thumb tab until the collar forms a seal against the external cervical os. The system can be operated in either automatic mode or semi-automatic mode. In some Model 9 RF controllers, a vacuum pre-check occurs automatically prior to the initiation of the ablation cycle. The vacuum LED will flash and an audible tone will be heard for up to 10 seconds as the system ensures a stable vacuum level for at least 4 seconds before enabling energy delivery. For this demonstration, we will operate in semi-automatic mode. Begin the cavity integrity assessment procedure by stepping on the foot pedal once. The cavity integrity LED flashes green in conjunction with an audible tone at a rate of 1 beep per second. The duration of the test will range between approximately 7 and 30 seconds. During this time, CO2 is passed from the NovaSure RF controller through the device tubing insufflating the uterine cavity. Once the uterine cavity holds 50 millimeters of mercury of pressure for approximately 4 seconds, the controller recognizes the uterine cavity is intact. The ablation cannot proceed until the cavity integrity assessment has passed. Once the cavity integrity assessment has been successfully completed, indicated by a solid green light on the RF controller, the circulator will press the Enable button. The physician will then initiate the ablation by tapping the foot pedal once. As soon as the vacuum pre-check has passed, a blue RF on LED will illuminate to signify energy delivery. Once the ablation cycle is complete, the RF energy delivery as well as the suction will switch off automatically. The physician can stop the progress of the procedure at any time by depressing the foot switch. The ablation cycle lasts approximately 90 seconds and will not exceed 2 minutes. Completion of this cycle is indicated by a green Procedure Complete LED on the NovaSure RF controller. Once the ablation cycle is complete, slide back the white cervical collar using the thumb tab. Unlock the handle by depressing the button on the side of the device. While holding the front handle stationary, pull back on the rear handle to retract the electrode array into the sheath using this bow and arrow technique. Remove the device. Please refer to the NovaSure instructions for use for the complete procedure steps, contraindications and warnings.